Picture this. You're in the NCLEX exam hall. The clock is ticking. A patient on your screen is gasping for breath, and one wrong answer could make the difference between passing or failing. Don't worry. Today we'll master fluid volume excess through 10 NCLEX-style questions, from easy to expert level. Stay with me until the end, because the toughest questions hide a twist most students never expect. Question 1. A patient with fluid volume excess is admitted. Which initial nursing assessment is the most reliable indicator of fluid retention? Blood pressure, daily weight, skin turgor, or urine output? The correct answer is daily weight. Daily weights are the gold standard. 1 kilogram equals about 1 liter of fluid. More reliable than blood pressure or urine, which can fluctuate. Blood pressure can rise due to many factors, not specific. Skin turgor is useful for dehydration, not overload. Urine output may decrease, but it's not the most accurate. Remember, on NCLEX, daily weight is always king for fluid balance questions. Question 2. A nurse notes bilateral pitting edema in a client's legs. Which explanation best describes this finding? Increased oncotic pressure, decreased hydrostatic pressure, increased hydrostatic pressure, or decreased capillary permeability? The correct answer is increased hydrostatic pressure. Too much fluid volume pushes fluid out of vessels into tissues, causing edema. Increased oncotic pressure would pull fluid in, not out. Decreased hydrostatic pressure would prevent edema. Decreased permeability would block leakage, not cause swelling. Think of hydrostatic pressure as water pushing. More volume means more push, leading to edema. Question 3. A client with fluid volume excess reports shortness of breath and orthopnea. What is the priority nursing action? Measure urine output, weigh the client, place the client in high Fowler's position, or encourage oral fluids. The correct answer is place the client in high Fowler's position. Airway and breathing always come first. Elevating the head of bed reduces venous return and improves breathing. Urine output is important but not priority in acute dyspnea. Weighing helps track fluid but won't relieve symptoms. Encouraging fluids is wrong, it worsens overload. On NCLEX, in respiratory distress, think position first, then medications. Question 4. A client with suspected fluid volume excess is scheduled for diagnostic testing. Which finding would best confirm this condition? Low BNP levels, elevated BUN and creatinine, daily weight gain of 2 kilograms in 24 hours, or increased serum sodium? The correct answer is daily weight gain of 2 kilograms in 24 hours. Rapid weight gain is the most sensitive and specific indicator of fluid retention. BNP actually rises in fluid overload, not low. Elevated BUN and creatinine indicate kidney disease, not always overload. Sodium is often diluted, not high. On NCLEX, daily weight beats labs when asked for the most reliable indicator. Question 5. A nurse is giving 4-furosemide to a client with fluid volume excess. Which lab value requires immediate intervention? Sodium 142, potassium 2.9, chloride 101, or calcium 9.0? The correct answer is potassium 2.9. Loop diuretics waste potassium, and hypokalemia under 3.5 can trigger deadly arrhythmias. Sodium is normal. Chloride is normal. Calcium is normal. Remember, diuretics drain fluid, but they can also drain electrolytes to life-threatening lows. Question 6. A client with fluid volume excess has crackles, jugular vein distension, and dyspnea. The nurse anticipates which priority medication order? normal saline infusion, furosemide 4, albumin infusion, or an oral antihypertensive? The correct answer is furosemide 4. Loop diuretics rapidly reduce volume overload and pulmonary congestion. Normal saline adds more fluid, making it worse. Albumin is used in hypoalbuminemia, but here excess volume is the issue. Oral antihypertensive is too slow in acute dyspnea. Always think, which intervention relieves the crisis fastest? Question 7. A client with cirrhosis develops ascites due to fluid volume excess. Which intervention is most appropriate? Administer lactulose, encourage high-sodium diet, prepare for paracentesis, or increase oral fluids? The correct answer is prepare for paracentesis. Paracentesis directly removes acidic fluid and relieves breathing difficulty. Lactulose is used for encephalopathy, not volume removal. High sodium worsens retention. Increasing fluids is contraindicated. Sometimes the correct intervention is not a medication but a procedure. Recognize when mechanical fluid removal is the answer. Question 8. A client with chronic kidney disease presents with severe edema, crackles, blood pressure 180/100, and oxygen saturation 86%. The provider orders 4 furosemide, but the client produces only 50 milliliters of urine in 4 hours. What is the nurse's next best action? Continue monitoring urine output, give more fluids to flush kidneys, notify the provider about possible dialysis need, or give an oral antihypertensive. The correct answer is notify the provider about possible dialysis need. When kidneys fail to respond to diuretics, dialysis or ultrafiltration is the next step. Monitoring alone delays treatment. Giving fluids is dangerous. Oral antihypertensive is too slow and doesn't solve overload. Sometimes the NCLEX wants you to see when diuretics fail. The answer shifts to dialysis. Question 9. A nurse is caring for 4 patients. Which client should be assessed first? A client with fluid volume excess reporting sudden shortness of breath, a client with mild ankle edema, a client with a 2-pound weight gain over 3 days, or a client receiving diuretics with potassium 3.8. The correct answer is the client with sudden shortness of breath. Acute pulmonary edema is life-threatening. Mild edema is not emergent. A 2-pound gain is concerning but not urgent. Potassium 3.8 is normal. NCLEX loves priority questions. Always pick the client at risk of dying right now. Question 10. A patient with fluid volume excess is receiving 4 diuretics. The nurse notices muscle weakness, irregular heart rhythm, and an ECG showing U waves. What should the nurse do first? Place the patient on cardiac monitoring, administer prescribed potassium, notify the provider, or stop the diuretic infusion immediately. The correct answer is place the patient on cardiac monitoring. These are signs of severe hypokalemia and arrhythmia risk. Monitoring comes first to detect and prevent fatal dysrhythmias. Giving potassium is correct, but monitoring is priority before meds. Notifying the provider is important, but not immediate. Stopping the diuretic is not ordered and could worsen overload. Remember, if the patient is unstable, protect first, then treat. And there you have it, 10 NCLEX-style questions on fluid volume excess, from the basics to the life or death ICU level. The exam isn't just about memorizing, it's about thinking like a nurse at the bedside. The secret twist? The answers often lie in priorities: airway, breathing, circulation, and safety. Master these, and you don't just pass NCLEX, you save lives in the real world.